Orophyrangeal airway insertion and bag valve mask reservoir ventilation. Step 1. Determine the need for orophyrangeal airway insertion and bag valve mask reservoir ventilations. Step 2. Preparation. BVMR correctly checked and attached. Attach oxygen tubing to oxygen cylinder in a BVMR. Open oxygen cylinder and adjust flow meter to 10 to 15 liters per minute. Select correct size OPA by measuring from patient's corner of mouth to angle of the mandible. Check that the patient has no gag reflex. Step 3. OPA insertion. Open mouth by gently pulling mandible downward. Insert tongue depressor to depress the tongue and gently insert the OPA following the natural curvature of the oropharynx. Advance OPA fully until flange rests against lips. Step 4. 1. Rescuer ventilation. Position yourself directly above the patient's head. Perform head tilt. Place one hand on the patient's forehead and push with your palm to tilt the head back. Place pointed end of mask over bridge of patient's nose. Use thumb and index finger of one hand to make a C on the side of the mask, pressing the edges of the mask to the face. Use the remaining fingers to lift the jaw, 3 fingers to perform an E. Open the airway and press the face to the mask. Compress the bag until chest rise is observed. Ventilate at a rate of 1 ventilation every 5 to 6 seconds for adults and 3 to 5 seconds for infants and children. 2. Rescuer ventilation. Rescuer 1 opens airway with head tilt chin lift. Place one hand on patient's forehead and push with your palm to tilt the head back. Lift the jaw with the other hand by placing your fingers under the bony part. Or perform a jaw thrust. Place one hand on each side of the patient's head. Place your fingers under the angles of the mandible and lift with both hands, displacing the jaw forward. Rescuer 1 seals mask against the patient's face. Once again, your thumb and index finger of each hand create a C to provide a seal around the edges of the mask. And your remaining 3 fingers form an E to lift the jaw and hold the face against the mask. Rescuer 2 now compresses the bag with one hand until chest rise is observed. Ventilate at a rate of 1 ventilation every 5 to 6 seconds for adults and 3 to 5 seconds for infants and children.